So try to pick, the top 3 and 4 major issues in any deal and focus on the big stuff and let a lot of the little things go. Because honestly, I'm reminded a doctor just the other day who had to let go an office manager, which again, newsflash, not all managers that are going to work with you are going to be wonderful. And I was like, let it go. Let her, don't worry about the small stuff. The big picture issue is that you're getting rid of a problem and you're going to bring someone new in, right? Always try to reframe it as, what are the most important things I need to talk about in this negotiation? Fight for those.
If you are a specialty or a primary care or a type of business where you don't need a lot of equipment, my advice would be to keep your startup cost really, really low, but spend the money on the things that are super important. That's where you want to spend your money on.
The idea is you work less, but you keep more. And so you make the same, or you can make more or less. But if you had a practice that brought in $1.5 million a year, but your overhead's $1.3 million, you take home $200K. But if you have a practice that, makes $300K and your overhead's $100K, you're taking home the same amount by doing far less work.
We have to know our weaknesses, right? I'm not a social media person, which, I'm learning a lot of things. But I hired someone who'd say, Sush, make the videos. Sush, make the videos. I'll edit, So you need someone. And I've always believed, right? Even if you hire someone, if they're, obviously you hire someone because they're better than you in that kind of, in that field. So listen to them. We don't have to be perfect in everything. So I tell my social media person, what do you want me to do? And she's like, do this from this angle and don't do this, So hiring people, outsourcing helps. A little bit of self-care and discipline has to be built, because one thing I realized when I started my practice is there is no end to what you can do.
It is great to have a website, and we give you that. I mean, you can have your website up and going within an hour or two with our template, but then you're like, okay, is it functional? You need it to be functional on the back end. You need it to be feeding the CRM with names, emails, contact information, and having them check off that little consent box that says, yes, I do want to hear from Dr. Mona, Dr. Marissa. These are the fundamentals of building your base of patients and followers that if they're not already a patient, they will become one.
Over 90% of the doctors that were sending me patients, all of a sudden it was as though I disappeared. Like I didn't exist anymore. And, the 10% that used to refer me patients would only refer me stuff because they felt like they were desperate and didn't have any other choice. And so getting patients in the door, as you mentioned earlier, Dan, that's always the big challenge.
There's marketing, which is the how you share your story out in the world. There's operations, which is how you do what you do. And then there's finance, which is how you count all the money and account for taxes. If you want to be a successful business, if you want to survive, if you want to scale, you have to put the right butt in the right seat. Okay, so there's 5 different butts for every company, and you have to have the right butt in the right seat.
I don't have a marketing budget, so I don't do advertising. My practice is a little bit different because I don't do much general psychiatry. It's a very small part of my practice. My practice is quite niche. I focus very strongly on reproductive psychiatry, and my other niche actually is working with adult video gamers, which is very specific. And so I generally target networking with potential referral sources around those areas. And that in effect has kind of helped in that I don't really need to do more general marketing, because when I started off my practice, I did do some Facebook ads and I did do some Google ads. And I found that it wasn't getting me the type of patients that I really wanted to see in my practice. Again, because my practice is very niche. And because of how niche it was, the word of mouth actually has worked much better for me, because the people who are referring to me, they know me, they know my practice, they know what the specialization is. And so when they send me patients, it's a really good fit for what I do.
The hardest part whenever anybody is making a big shift in their practice and they're driving things towards a very particular goal is that we tend to get stuck on, but this person's been with me forever. That doesn't have anything to do with this. You can find new loyal people if you needed to. This is about an honest assessment of how open are they going to be to any changes that you might want to make or, growth in your practice. So just because they're loyal and they've been there for 5 years that means they're loyal to doing it the way you've done it for the last 5 years. So if you're making some big changes or you're trying to drive the practice a new way, you need to make sure that they're going to be loyal to where you're bringing everything.
I really work with the patient, explaining them how the breakdown of the surgeon's fee, the anesthesia, and the facility, because I let them choose which way they want to go. Particularly because I'm on staff still at the hospital for patients that are inpatient that I need to do, like diabetics, and do a salvage procedure. But in the ASCs, a lot of my Medicare patients want to use their Medicare, and it will cover their facility and their anesthesia. And then I just carve out my surgeon's fee, which I was always doing beforehand because I wasn't employed.
When they walk into my office, I want them to feel at ease. When they are sitting in my lounge waiting for me, if something comes up and they need to ask something, that person that's at that front desk when they walk in the door, I want them to know that that person's accessible and friendly and not intimidating or rushed or busy seeming. That should never be the case. They should be able to ask them anything, and if they don't know the answer, be kind enough to say, you know what, I don't know that, but let me ask Dr. Schachter, and when I get the answer, I will most happily give that to you. Or if they know the answer, offer them whatever it is that they need.
How much do I need to earn? What's my bottom line? So looking at all expenses, it's about $10,000 per month, mortgage, childcare, et cetera, et cetera, et cetera. For some of you, that number's like way too low. For some of you, that number is doable. For others, it's like, oh, I don't need that much. How many days a week do you really want to be working? Check inside yourself. For me, it's 3 days. And I go by the 4 weeks because, most months are 30 days or 30, there's a few 31. And so you collect all those other extra days. So I do it over 4 weeks. So 10K over 12 days would be $833 a day. Are you guys following me?
I think for a lot of docs who want to start, it's like, oh, how do I get the LLC? How do I get the business bank account? How do I set up a website? And like those things are somewhat daunting, but they've been done many times before. And I don't really think that's the hard part because they're solvable problems. Like once you get it, you'll get it, I think the hardest part of any of these practices is just getting patients. That's it. If you have patients, you have a practice, even if it's not run well. But like I've said before, you have the perfectly set up, super shiny practice. You don't have any patients, you got nothing. So getting patients has always been the difficulty. And it takes time.
And so looking at the types of medical practices, there's so many types, anywhere from hospital-based, locums, integrative systems, HMOs, the private practice groups, which are sometimes physician-owned or IPA-owned. And so with the IPAs, they tend to gather small clinics and create a coalition so that they can negotiate for higher pays or higher reimbursement for either fee-for-service or by a capitated model.
So you have to really know who you are and who you serve clearly. That's going to make any AI aids that you have in your practice, whether they are answering your phones or chatting with people on social media, that much clearer and better at letting people know, yes, this is the place for you, or no, it's not. And again, I think that's something that comes counterintuitive to most of us as healers, as people who went into medicine to help people. It feels bad to turn people away. But if you're going to succeed in a cash-based practice, you have to be very clear, and people actually appreciate it.
If you've ever felt like medicine was draining you, realize that it's the system. It's crushing you. It's making you work at every minute, filling your schedule up so that you're busy every moment of the day and after hours. So it's not you. You are not broken. You were just built for something else. It's like the old movie, The Matrix. Are you going to take the red pill or the blue pill? Now that you know you have options, you can decide.
Maybe if you're in Facebook group with other physicians, you're at least networking and there's a referral base there that you can connect with. And like Dr. Leroy said earlier, like all it takes is just one person. If you're doing it from a physical practice, just one person from the community to recognize that you're special and that you're a really good physician, and they will refer you their patients. And if you get 2 or 3 of those, a lot of times you're set, you're golden. So just keep that in mind.